I'm Dr. Sanjay Desai, a vascular and endovascular surgeon. With the growing medical technology and medical science, a lot of improvements have happened, a lot of advancements have happened, and vascular being a relatively new surgery, lots of endovascular work is happening, and endovascular is now overtaking the vascular work, which I think all of us are aware. We like to do everything in minimum. And when we were at this crossroads, when more of endovascular work started, we needed dedicated endovascular spaces, and then once we started combining procedures, we needed hybrid spaces, and that is when we spoke about combining surgery and endovascular cath lab. And hybrid OTs were becoming the norm of the day at that time, and that is when we started looking for a machine, a Ziehm or a cath lab unit where we can consider doing both the procedures. And we did quite a fair bit of research extensive to find out what could be suitable, and came across Ziehm, which was the machine we finally installed in our institute, and definitely happy with the machine. And at the time when we bought the machine, I think this was state of the art. More than state of the art, I thought this was the only machine which actually looked at vascular and was designed for vascular work, because most of the cath lab or Ziehm are designed for cardiac and fixed cardiac work or endovascular work, whereas Ziehm I thought was pretty flexible. It was quite obvious when we saw the machine that somebody who designed it or somebody who worked on it worked with vascular in mind. So that's the first thing which came up to us. And yes, definitely when we were going through the different companies, we were also pretty much comfortable with the people who came across, the service engineers, the technical people, including the machine expertise. We did see the machine and they were knowledgeable. And like I said, they were perfectly understood what was needed for vascular, and that is when we decided I think this would probably be the good machine for us. Over the last couple of years of people working in cath lab and other areas, we have been seeing the side effects of radiation. I think we all know that it has an effect, though it's negligible, but we do know. And the good thing about the Ziehm machine is its radiation hazards is probably 1/100th of what happens in a fixed unit. It's a very focused area. It has very limited dispersion of radiation, and even though we are pretty close to the machine and operating, we still don't have that machine. I think this is something which we used to feel and we discuss among ourselves when we did cases, long cases, 3-4 hours in cath lab. By the time we are done with the case, the evening used to be so tiring and you could feel that exhaustion. But lately, touch wood, I think we have been doing cases and there is absolutely no feel of that. So I wouldn't technically have measured the radiation, but definitely I can feel that it is definitely less. The other aspect again is the heat generated. I think this particular system has got a cool generator, so even long procedures, it automatically detects the heat and it starts cooling the machine, and it doesn't interrupt our procedures. It doesn't stop, it doesn't say radiation dose limited, or it just shuts down. That is something it warns us. The cooling actually automatically starts increasing and it cools the machine. So even longer procedures are done pretty comfortably, and definitely safe. It's got us in picture when the machine is being designed, and probably more comfortable. And safety, yes, it's just not the doctors. Like I said, there are so many people in the hybrid OT when cases are going on, from nurses, ward boys, paramedical staff, OT assistants, anesthetists, and etc. We have to look at all their safety and the patient, of course, though there is not repeated exposure. I think that makes it probably a better option that we choose machines which are more radiation safe. Well, in technology, or whenever we are doing different things, just take for example new cars, new mobiles. We are not even using 30% of what features a device has. I think that's the problem. And as we learned, and as we are learning endovascular, we are realizing that if we have the right material, if we have the right catheters, if we have the right endovascular equipment and the C-arm unit with what we need to do, it makes life easy, it makes procedures pretty comfortable, it makes impossible possible. I think one of that feature is the roadmap. I think roadmap is something which a lot of them don't use. We also have started because we are learning into endovascular and we started. Roadmap is something you can have an image and drive your catheters over it, put your stents over it. You can be precise to where you're placing your stents and balloons, so that gives you a perfect mapping of where you're going. And this feature is very important for endovascular work, and especially when it comes to this machine. The roadmap here is you do not have to run a separate DSA every time you want to do a roadmap. You don't have to. You can capture the roadmap from the previous images and then put it on and then just save it. So you just decide you want to go back and have a roadmap, you can just fix it on a run image already. And second, you're avoiding the contrast. You don't have to give another dose of contrast, again fix the table there and then again do the procedure. That's not needed. And third, obviously the radiation. You're not exposing to another dose of radiation, whether you do a fluoro or a CINE, it's not needed. So I think that feature of road mapping with this makes it much easier. Now in fact, with so much of safety, with the less radiation which it is doing, and we are able to capture, sometimes when the wire doesn't go, we just go back to the previous image, create a road map and then just run the wire across. So it makes life more easier. And like I said, when you utilize technology to your advantage, it makes life easier. And most importantly, some of the things where at the end of 45 minutes, 1 hour, we think we'll give up, this lesion is not going to cross, and then just use some of this good technology, whether it's the catheters or the imaging, and then you just get through and you can definitely get over something which you thought is impossible. We can make it possible. I think that's another added feature in what we can see in this machine. Yeah, I mean, some of the procedures, if we look at major procedures, I mean, if you talk about technically major procedures, you talk about AAA and major renal transplant, renal artery stentings, mesenteric work, etc. But then I still think the best utility of a C-arm unit or a hybrid unit is when you mix both, and that is where the challenges are, and that is where it makes life easier. So I still feel an endovascular work combined with the surgical work has done. So a couple of incidents I would like to say is where we have taken up patients for iliac artery remote endarterectomy with the distal bypass, and then when you go in, you open the vessel, then you attempt to push a wire. Because you have fluoroscopy, you have the C-arm imaging, you can look at how the vessel is, improve the inflow, you're done away without opening the abdomen, and then you go down below. Since you have the vessel open, you can try to push your wire down and see whether we can get away. And a lot of times we have just got away with a complete endovascular work, except that we have opened the vessel to get access and done a endarterectomy there, and you could do away with without a bypass and a complete endovascular work. I think that's the importance, more than doing complex procedures. Yeah, when you talk complex, you could talk about thoracic aneurysms, abdominal aneurysms, or bigger cases. Even there, the imaging with couple of cases we have done is pretty good. And more than that, especially it gives us the confidence that we can open up this patient at any time if things are not looking okay on the same table. No need to shift the patient out, and you just move the C-arm away and then just get on with your open work. That makes it much easier. And again, the important thing is doing a completion angio. After you've done a bypass or you've done an angioplasty, you can just do a small shot and look at how the distal vessels are, whether your bypass is fine, any other new lesions are there, and if needed, you can correct it at the same sitting. So I think they are some of the things which makes a difference when you talk about doing procedures in a hybrid OT. Thank you.
I am Dr. Chandrasekhar, working in MS Ramaiah Medical College as a vascular and endovascular surgeon for the past 15 years. I just want to share my experience with Ziehm Vision RFD hybrid procedure. I just want to share one of these procedures, especially in a long segment SFA occlusion. 5 years back, we used to do femoropopliteal bypass surgery. Now we are doing all these patients under endovascular. We can still go and do endovascular procedure, either an angioplasty or placing a stent. Once when we do, they get discharged immediately after 48 hours. The hospital stay of this patient is also going to reduce. We have been doing this procedure for the past 5 years, and this procedure has been published in a major international journal. This is my wonderful experience with Ziehm RFDI hybrid OT in our center. Thank you.
Hi, I'm Dr. Rajendra Prasad, vascular endovascular surgeon from Ramaiah Hospitals, Bangalore. I would like to share some of my experience in hybrid OT. We came from an era, started our practice or training when we were doing our endovascular procedures in a Ziehm, and then we graduated ourselves up to the cath lab. Now state of the art technology, that is hybrid OT. So coming to the image quality compared to cath lab, so with a smaller powerful machine you are getting images as clear as a cath lab. I can watch for it, and then I can just only 2 words can explain the quality of the image from this machine. They are crystal clear and also razor sharp. So with a touch of a button we can change from DSA, RSA and then also CINE. So with a single touch of a button you can change our DSA to roadmap like this. So which is very useful for navigating our wire and then devices into the desired position. And also this can be done with a dedicated foot switch also. There is one very advantageous tool called as anatomical marking tool, wherein we can exactly mark the level of the branches, like in an EVAR where we are able to land our device, something like renals can be marked, and also in iliacs what is the length of the lesion and also what is the level of the occlusion. Diameter of the blood vessels can be really measured so that we can take out exactly fitting devices like a stent or a balloon. So this is a very helpful tool in this machine which will really help especially for the peripheral vascular interventions. Thank you.
Hello everyone, I am Dr. Vivek Vardhan from Ramaiah Memorial Hospital. I am a vascular and endovascular surgeon. The best part about the Ziehm Vision RFD hybrid is the ease of use. Now this is aided mainly by the joystick that's provided along with the device, which not only aids in 4-axis movements, also has a collision warning system. Now the best part about this is the dependence on the hybrid technicians is actually quite less. So what I think and what I want to do, I actually can do everything with the joystick itself. This means to say that I can position the patient the way I want it, I can change the axis of the Ziehm the way I want it, and also the best part about the device is it's got anti-collision sensors which actually prevent the device from getting damaged, which can be quite expensive on a long run. Shift from, let's say, from left to right at the touch of a button. Apart from that, the joystick also has got touch sensors, which means to say I can give precise movements and accidental movements of the console is avoided. The Ziehm Vision RFD system has got various applications which includes pure interventional procedures or open vascular procedures.
Thank you.